Tubbs has successfully tolerated her rate being dropped from 10 breaths per minute to 4 breaths per minute while on the ventilator. Her pressure support and PEEP are at 5 centimeters of water each, and her FiO2 is set at 35%. Normal weaning parameters include the evaluation and assessment of the patient's spontaneous tidal volume, respiratory rate, Tobin index, vital capacity, negative inspiratory force, and non-invasively obtained oxygenation and ventilation values. For Mrs. Tubbs, a successful spontaneous tidal volume must fall between 4 to 6 milliliters per kilogram of her ideal body weight. This means that the exhale tidal volume read on the ventilator must remain between 200 milliliters and 300 milliliters during the spontaneous breathing trial. A successful and normal spontaneous respiratory rate would be a value less than 30 breaths per minute, but still greater than 10 breaths per minute. Mrs. Tubbs' Tobin index or rapid shallow breathing index, later listed as RSBI, must be calculated. Taking her spontaneous respiratory rate and dividing it by her spontaneous tidal volume in liters, I can better predict her weaning success, which is independent of her own efforts. Mrs. Tubbs' RSBI has remained below 100 during her breathing trial. Mrs. Tubbs is off of sedative medications and is able to follow commands. This is an important fact given that the vital capacity must be done as the patient follows timely instruction. A successful series of vital capacity tests, because remember, we're taking the average of 3 tests giving rest in between. These values must remain between 10 to 15 milliliters per kilogram of her ideal body weight. This will look like 500 to 750 milliliters from a maximal inhalation and exhalation from a starting normal tidal breath. The negative inspiratory force also requires that Mrs. Tubbs be able to follow timely instructions. This test will help indicate how well she can initiate a breath on her own. Due to her recent history of COPD exacerbations that have caused her to endure extended stays on the vent, I expect her NIF, or negative inspiratory force, to be around negative 30 centimeters of water. During all of these tests and assessments, I have been monitoring, non-invasively, Mrs. Tubbs' ventilation and oxygenation from her capnography reading and SpO2 reading. She has well tolerated this treatment.
When weaning your patient off the ventilator, it is always a great idea to explain the procedures to your patient. Weaning from the ventilator can be a very scary process. Make sure your patient feels comfortable with what you're getting ready to do. Mrs. Tubbs, I spoke with your doctor, Dr. Nose. He's asked me to help you breathe a little bit better on your own. Right now you're at a rate of 10, and he wants to see you do a little bit more work by breathing at a slower rate, where the ventilator isn't helping you as much. So we're not going to go from where you are now to where he wants you to be in a quick one-step process. This will be over a period of several minutes. I'm going to watch you, see how well you're tolerating. I'm going to watch your monitor and make sure everything works out okay. Are you ready to begin? I want you to relax and just keep breathing and take in some good effort, okay?